Namaste, everyone. I'm Dr. Roma. I'm a senior medical officer and assistant research scientist at ABP Research Foundation, Coimbatore. Today, uh, we'll be discussing about the topic postnatal care in Ayurveda. Yes. So we know that after childbirth, a woman's body goes through many changes. So in Ayurveda, this period is called as Sutika Kala, and a special care known as Sutika Paricharya is advised to help the women regain her strength as well as to support her recovery after the childbirth. So today we are going to see about the postnatal care and what are the uh, diets, the regimens, and the therapies advised in Ayurveda. So, pregnancy is a natural process in which a baby develops inside the mother's uterus. So, this period lasts for about 9 months. During this time, the mother needs special care in terms of nutrition, proper rest, and good mental well being, as well as good medical support. So, once the baby is born, the next phase begins, which is called the postpartum or postnatal period. So, this period usually lasts for about 6 weeks, and during this time, the mother's body gradually returns to its normal state after the pregnancy and the delivery. So in Ayurveda, this period is called as Sutika Kala. Sutika means a woman uh, uh, after the birth, the mother is called as Sutika. So this is usually considered to be the first 1.5 months after childbirth or until the woman gets her next menstruation. So this period is important because childbirth causes many changes in the mother's body, like Vata dosha becomes predominant due to the emptiness created in the uterus and the effort during the delivery. And the here this Sutika Paricharya or postnatal care helps to regain the strength. Also, it stabilizes the doshas and support healthy breastfeeding, which is also very important, and prevent long-term health issues such as backache, hormonal imbalances, fatigue, etc. So, if proper Sutika care is given, the mother recovers well and returns to a stable and healthy state. So what are the objectives? The main goal of the postnatal care is to help the mother regain her health, okay, and strength after the delivery. So because child birth weakens the body, and as I said, Vata dosha will become predominant, leading to fatigue, pains, and even digestive issues. So the first priority is to restore the physical energy and also to improve the digestion, at the same time, to reduce the body aches and lower abdominal pain and other uh, uh, issues which commonly occur after childbirth. So, also proper care helps prevent the infections in the uterus and supports the natural healing process. Another important objective is to support healthy breastfeeding to improve the quality as well as the quantity of the milk, to improve the milk production. So, along with physical care, emotional support and a peaceful environment is also very important after childbirth. So, the management in Ayurveda, the postnatal care is uh, not the same for every woman. The type of management given after delivery depends on several factors. Like first, we look at whether the pregnancy was natural or occurred with the support of fertility treatments. So, such treatments and medications can influence the mother's hormone balance and overall strength. So, next, we consider the conditions that occurred during pregnancy. For example, if the mother had any illness like anemia, hypertension, diabetes, or thyroid problems during pregnancy, the care after delivery need to be adjusted accordingly. So, Ayurveda divides this postnatal care into three stages. The first stage starts immediately after childbirth and it continues for about 10 to 14 days. During this time, the body is still recovering after the labor, all the strain and pressure after the labor. So the body is still recovering during this period. So here, the vata is definitely predominant and it's significantly aggravated, and the digestive fire is very low. So the focus in the stage is on improving the digestion and relieving the pain and helping the uterus cleanse and contract back to its normal state. So here, light and easily digestible food is given so that the mother can properly absorb the nutrients and without causing much heaviness and bloating. Okay, so here, as the already the digestion is weak and digestive fire or agni is weak, light and easily digestible food is recommended. And this stage is all about gentle support, simple food, some warmth, and some therapies which will allow the body to begin healing naturally. And the next stage, which is the stage two of postnatal care, begins after the completion of the first 10 to 14 days. This phase lasts for about another next 2 weeks. So by this time, the digestive fire has improved slightly, and the initial cleansing and pain relief measures are complete. So here, the main goal during the second stage is to strengthen the mother's uterus, also the pelvic region, the abdominal muscles, and also her bones and joints, because childbirth causes a natural loosening of and weakening of these structures. So they require focus, nourishment, and support, and that is done in the second stage. And the next is the third stage. Third stage of postnatal care extends up to until the 45 days after delivery, or sometimes until the mother gets her next menstrual period. By this stage, the mother has passed through the initial recovery and strengthening phases, and now the focus shifts towards the nourishment and rebuilding the physical as well as the mental health. So during this time, the medicines and formulations that are Rasayana and rejuvenating are usually given. And this helps nourish the tissues and maintain, and also to have good breast milk production, and also improve the mother's energy and immunity. So these preparations also help to prevent long-term issues such as fatigue, backache, sometimes hormonal imbalances, as well as emotional instability. So here there are in Ayurveda, we have different therapies which we recommend after the childbirth. So during labor, the mother undergoes significant physical effort and strain, which will greatly increase the vata in the body. So this rise in vata will lead to muscle stiffness, sometimes joint pains, too much tiredness, fatigue, dryness, and even emotional sensitivity. So here, Abhyanga. Abhyanga means helps to soothe the body and as well as they balance the vata. So Abhyanga is oil massage, whole body oil massage. Here, warm oil, it penetrates the tissues and it helps to relax the muscles. Muscle spasms will be relieved and enhances the circulation in the body. So it strengthens the muscles and the joints that were weakened during the pregnancy and childbirth. So this in Abhyanga, it is a massage. The slow rhythmic massage movements will calm the nervous system, and it also reduces the stress and anxiety, and it promotes the emotional stability, which in turn improves the sleep. Okay. So after the massage, a warm water herbal bath, which is called as Vedukuli, is also recommended. So the warmth helps improve the circulation and reduces the body stiffness, pains, and it gives a sense of relaxation. So together, this Abhyanga and Vetukuli help the mother regain the strength and calmness both physically as well as mentally. The next, postnatal hygiene is important in preventing the infections for for wound care, especially in cases of perineal tears and in episiotomy or general soreness. Ayurveda recommends using water that has been boiled with certain herbs like neem leaves or turmeric or nalpamira. So these herbs are naturally antiseptic and anti-inflammatory. So they help to cleanse the area gently without, while also it will also encourage faster healing also. And oil application in the head is another important aspect of postnatal care. It nourishes the scalp and reduces dryness and helps to calm the nervous system. The stretch marks. We know that after the pregnancy, the skin stretches rapidly to accommodate the growing baby. So after the delivery, the stretch marks can be seen, and the skin begins to contract after delivery, and these marks may appear very clearly. So applying some herbal pastes made using sandalwood, called as chandana or ushira and manjishta. So this will help in improving the skin color and texture, and also reduce the pigmentation over time. Okay. Uh, Next is another therapeutic procedure which is called as Udvartana. Udvartana is herbal powder massage. Um, so it is ideally performed after light oil application so that there won't be too much dryness or skin irritations. So this herbal powders gently, it will exfoliate the skin and increases the lymphatic circulation as well as improve the blood circulation. So this not only helps to reduce the stretch marks, but also it tones the skin. It reduces the abdominal fat and supports gradual weight reduction. So it helps the mother regain her natural body, the shape, and good health. So with regular practice, visible improvement can be seen in the skin firmness, and the stretch marks will be fading. So next is the abdominal wrapping. So in women who have had a normal vaginal delivery, abdominal wrapping or udaraveshtana can be done along with regular oil massage and bathing. So the abdominal muscles becomes stretched and weak. Okay, so after the delivery, so the uterus is also slowly returning to its normal size. So because of this, the abdomen may feel loose and the back may feel unsupported. So abdominal wrapping helps in providing gentle support to these areas. So and also it helps the belly regain firmness and tone over time, and gives structural support to the lower back, which reduces the back pain, and which is very common complaint after the delivery. And this also helps to prevent the excess gas accumulation in the abdomen by controlling the vata, which is naturally aggravated after childbirth. However, it is important that the wrapping is done correctly, uh, but not too tight or not too loose, so that the circulation and breathing are not restricted. When done properly, this Udaraveshtana is very effective and simple postnatal supportive practice. And the next very important thing is the mental health after delivery. So after childbirth, we know many women experience emotional ups and downs, which is common. So this usually happens because of the sudden hormonal changes, the physical exhaustion, and the new responsibilities of carrying a newborn. So the mother may feel sensitive, sometimes very tearful, very overwhelmed, anxious during this phase. So Ayurveda provides gentle supportive measures to help the mother stay mentally calm and emotionally balanced. Like warm oil massage or abhyanga helps to relax the muscles, improves the sleep, and reduces the vata imbalance. Simple head massage, as I said, in some cases, shirodhara is also beneficial. So along with this, some herbs which help to improve the mental emotional strength and mental clarity can also be used, and simple practices like slow deep breathing and pranayama, short meditation sessions can also help calm the mind and stabilize the emotions. Then very important thing is the diet. So after childbirth, the digestion, as I said, it becomes weak. So Ayurveda advises the new mother to avoid foods that are very spicy, very sour, or which are very heavy to digest. So these foods can irritate the gut and cause digestion or lead to gas, bloating, and discomfort. So also avoid drinking unboiled water. Okay, water boiled with dried ginger and cinnamon or coriander is very beneficial because it helps to improve the digestion and reduces the bloating, and also supports detoxification. And also heavy foods or too deep fried foods, too much heavy meat, junk foods, processed foods, all these should be avoided in the early post delivery period, as they are very heavy and it is difficult to digest. So instead, we have to focus on food which is warm, freshly cooked meals, and that are simple and nourishing. So fiber-rich vegetables, leafy greens, and fruits help maintain healthy bowel movements, which is very important in the postpartum stage. So this approach supports digestion, it prevents constipation, and also helps the easy recovery. The next very important thing is rest. So it is very important aspect in the postnatal care. So during pregnancy, the uterus, we know that it expands significantly to accommodate the growing baby. And the body undergoes many structural and hormonal changes. So after delivery, the mother's body needs time to recover and regain the balance. So if proper rest is not taken during the Sutika period or post-delivery period, it can lead to a long-term issues like backache, joint pain, and constant tiredness. So these are commonly seen in women who resume heavy household and other works too early. So adequate rest allows the uterus to gradually return to its original size and position. It also helps the muscles, the ligaments, and the pelvic structures recover properly. Along with the physical recovery, rest also supports the emotional stability, which is very important in the early phase of uh, uh, post delivery. So, encouraging the mother to sleep when the baby sleeps and avoiding heavy tasks and support is also very crucial for the long term health. The next is exercise. Uh, so, after completing the Sutika Kala, which is around 1.5 months post delivery, the mother can begin gentle exercises, like how the exercise must always match her uh, current physical capacity. So the idea is moderate effortless movement, not too intense workouts. Okay, so these exercises help in strengthening the pelvis region, the pelvic floor, the abdominal muscles, and the back muscles, so which may have weakened during the pregnancy and childbirth. So it helps improve the posture and increase the stamina gradually. Also, avoid overexertion or sudden heavy exercises. So, what is recommended is gentle yoga practices, gentle stretches, and breathing exercises, and light walking. So, all these are generally recommended in the postnatal period. So, thank you everyone for listening. We have seen postnatal care is just as important as care during pregnancy. So, through simple Ayurvedic practices, right diet, rest, and gentle therapies, we can help the mother recover completely and enjoy a healthy motherhood. Thank you.